All right. Good morning, and a very sweaty welcome from me. Hug, anyone? No? Fair. If you could just do the usual and put a 1 in the chat to let me know that everything's working. My earphones haven't melted to my head. Graham, you've always had my heart. Thank you. Things are working. Oh, lovely. It's not just me and Graham. Joanne's here too. That's sweet. Lovely. Claire. Oh, Claire's here. Claire's here, everyone, from the Cambridge practice. Can we get a whoop whoop? All right, steady on, everyone. Right, so let's dive in. What's new this month? Well, this time when we met, we were talking about new health minister. This month, we're going to be talking about a new prime minister, and no end of speculation as to when and where we might see Wes again. I've been practicing that all morning. I'm really glad I got that out. Far more importantly, though, the mycare.scot app can now be downloaded onto smartphones, giving people across Scotland direct access to their health information on their phone. Woo woo! Oh yeah, you've not got your mics on. Okay, just me. Fine. Woo woo! And excitingly, this is great news. For Surgery Connect users, particularly those on System 1, stand by your phones. Great news. Can I get a drum roll, please? Gonna have to get some sound effects for next week. Right, subject to final testing, check and cancel, people, is going to be available to you to use from next week. Next week. Yes, all right, we have found some emojis. We can work with that. All right, is Elizabeth Payne on the webinar? Is she here? Let her be here, because this one's for her. All right, nothing. Fine. Well, that fell flat. Fine. All right, Elizabeth, it's over. One last thing, though. More good news. Surgery Intellect powered by Tortoise users, there are going to be new templates and meeting functionality, 2 things I know you've been clamoring for. That's also coming by the end of June too. So really exciting news from the product team right across the board. Everything moving in the right direction. To today's webinar. Last month, we had Max on. He was talking about digital fatigue and how there is an overwhelming amount of tech out there right now for you to choose from. He illustrated, I think quite aptly, we'll give him that, how a connected ecosystem supports a more equitable patient access journey and what that might look like through the Exon suite of tools. Today, we have 2 powerhouses. Yes, powerhouses, I used the word. They are experts in making the tech work for you. That's what they're here to do. They're here to optimize the tech, make it work in the best way possible. But before I introduce them, fingers at the ready, because I've got my icebreaker. Let's be having you. Imagine this, 8:15 on a Monday morning. Yes, I know, horrible time. What's causing the biggest headache in your practice so far today? 8:15 on a Monday morning. What's causing the biggest headache? Is it phone queue is already longer than your coffee break? Is it that the online consultation inbox is filling up faster than you can review it? Someone's called in sick and you're firefighting already, or something I haven't thought of or added to my list? Valid answer is all of the above. Whilst you're thinking about it, and you know the drill, no overthinking, just put your feelings in the chat. It's a safe space here. I'll get on with the usual bit of housekeeping before we get started. Firstly, to say the call is being recorded for prosperity and sharing. So if you need to drop off, you're not going to miss a thing. We aim to keep you for no more than 30 minutes. Thank you, Sandy. I feel your pain. Right. Second of all, we love the questions. So if you're new here, again, don't think too hard. Just pop your thoughts into the chat as they come to you, and we'll get to the questions as and when we can. My name's Lucy Glynn. I'm the community manager here at Exon Health. And with me today, we have not 1, but 2 absolute experts in how to make your digital tools work harder for you. They are Ellen Gatlin, Head of Customer Experience, and Gemma Curtin, Customer Success Manager. How are you both doing? I know I've built this up and you're absolutely terrified by what's to come. I promise to go easy on you.
We're good to go. Excited.
Yeah, look at that. Excellent. Well, do you know what, Ellen? You spoke first, so we're going to start with you. Because the landscape has changed a lot, I think, over the last few months, particularly with the GP contract, with the sort of emphasis and impetus being on the data and how to understand it and optimize. It's made your job far more important. So tell us about it.
Cool. Okay. So yes, like Lucy said, I am Ellen, Head of Customer Experience at Exon Health. And like she quite rightly noted, Exxon Health has gone from just being a telephony provider, now breaking out into a number of other work streams with our product stack in digital assistant, AVT, and of course voice agents. So that has meant, as a team, we've had to change and adopt the way that we're interacting with you as our customer to make sure ultimately you are getting the absolute most out of the products and features that are available. So just touching very quickly on what to expect as a customer and that point of contact. Everyone on this call has a dedicated day-to-day point of contact in which is a customer success advisor. You may not know exactly who that is at the moment, but by the end of this call, we will make sure you do know who those people are. But just to give you a bit of detail around what that means is ultimately a CSA's role is there to handhold and to help and to support you in making sure that ultimately you have the best feature adoption and enablement. And we are able to supercharge your practice to be able to make sure your patients are getting the best possible outcomes, but also as a practice, we're helping strip away some of that demand by building out your call flows in the best ways possible, which Gemma will touch on shortly. So that CSA is your day-to-day point of contact. They will be running through account reviews, which we are going to go into a little bit more detail on as well. Also within the customer experience team, we have the wonderful training team. They work hand in hand really across the business, supporting all of our customers. And really they're there to help you with the onboarding. So whatever product that is, they're there to help support and make sure you understand exactly how it works in practice, but also very much available for refresher training. We know the landscape's changed a lot, particularly over the last 18 months to 2 years. There's a lot happening. Everything's moving at great pace. And the training team is there to really help support you. Refresher training might be as simple as just understanding how the phone bar might have changed over the last year and perhaps features you might be missing there. So a really, really valuable part of the team, which all of you have access to whenever you need training, whether that be virtual or on-site training as well.
I'm going to interrupt you there, Ellen, as well. And I'm sorry, but
no,
it's also worth a mention. I think that the new academy's just launched as well, hasn't it? So you talked about the training team being readily available. The academy is sort of an arm of the training team that people can access at any time at their own pace. And it's all been modelled now, hasn't it, around your job and the sort of courses that reflect the day-to-day operation, as you've all alluded to. Thank you in the chat. So worth picking up on that as well.
Definitely. Thank you, Lucy. And so what does that mean for you as a customer? We have quite clear touch points for you. Like I said, it's a fairly newer process for our customer base, given how much we've grown in terms of our product stack, and what you can expect. Really, every 6 months, you need to be having an account review with your CSA. That really is an opportunity to, one, make sure you understand exactly what you're using, and also looking at the data. How does it validate all the decisions that you're making, whether it be a new feature like check and cancel, adding into your Xflow? What does that actually mean for your practice, and where can we access the data to really back those changes that you're making? So those 6-month reviews are really powerful and really important. And if you haven't had one or are looking to book one in, I know Lucy will touch on it at the end of the call, but do drop your details in the chat and we will make sure your CSA reaches out to you today to get that booked in. And of course, with all of that, what does that actually mean? So for Exxon Health, we are wanting to empower you as a practice, PCN, ICB, to ultimately make sure you're giving your patients more choices in how they access care. And it's I'm a real advocate of patient choice. You know, by having the right technology built in the right way, you are allowing your patients to make sure they're making the right decision in how they want to access your practice, whether that be via a voice agent, a digital assistant, or just new features that you're accessing within your Xflows. We still want to give the patient the choice on what suits them best. And with that in mind, I'm going to hand over to Gemma now, who's going to talk through a little bit more about the account reviews, what to expect, and some wonderful features that we have available.
Good morning. Thank you very much. What I thought we'd do today is just have a brief overview of what an account review would look like for you. All of the CSAs like to do lots of digging into the background of your system to find lots of relevant information that we can use to support you with growing your online offering, but also teaching your patients and signposting where your digital options actually are. The first thing we do actually look at, and then we look at in quite a lot of detail, is your call flows. There's an awful lot of included features in these services that you're already paying for. So we want to make sure that you are getting the most out of that service. The beginning of an account review, we'll generally have a talk about what your issues currently are, what your struggles are, what are your pain points, and we'll have a look at some of your data. So bits like your DNA rate and your NHS app utilization. We'll use those to fuel those conversations with you. One of the biggest change we have been making for practices that we've seen some fantastic data come out of is actually amending your call flows just to add in or relocate signposting that you currently have. Lots of practices have loads of information within their call flow, so telling people all about your online consultation tool, signposting people to where you want them to go, and highlighting the NHS app. But we find that a lot of that information is all in one place, and patients tend to switch off. So by the time they actually get through to your menus, they're not paying attention. So one of the main things we have been doing is moving that information. So we are signposting at point of need and keeping that information relevant to the reason that that patient has called in today. Utilizing the menu options within your call flow, we can also then pull reports in the back end of your service to see how many people are actually choosing those options, hearing about that digital offering, and how many people are then choosing to hang up and go down that digital route. This is then opening up your phone lines for the people that really need your support. All of those messages are customizable. So we work with you and any needs that you have and any pushing we want to do and educating people so that everyone is given the information of where you would prefer them to go for that digital offering, as well as always giving them the option to stay on the phone. Within that call flow, we also have some other features that we can use. I didn't realize there was a little poppy up bit there as well.
Nor did I, sorry. I clicked over, but yeah.
Well, all of these prompts, as it shows, are text to speak. So we are happy to make these amendments for you. So if you're not confident in actually using Xflow in the background, your customer success advisor is more than happy to make these changes on your behalf. But we are also quite happy to handhold you through the process to make sure you are comfortable with making these amendments yourself if you would like to.
And just sorry to support on that, where we have started making great grounds with some of our practices and changing the menu options or just simply certain terminology that perhaps was relevant 3 years ago and now it's not. The patient demographic is very different. Their understanding of the digital landscape is different. Very small tweaks like a simple word can make a huge difference to a call flow. So it's really just to sort of support that with Gemma, it's really important that you get that messaging right for your patients and really understand what those needs actually are and that we're not just giving information for information's sake. Sorry, Gemma.
No, carry on. One of the features that we do have that is an inclusive feature is your check and cancel. As you've heard from the amazing Lucy, it is going to be available for TPP very, very shortly. Check and cancel can make a massive difference in your call flow. We work with you to identify where the best place it actually sits within your call flow so that we can get the best data for you. But this is a service that is available 24 hours a day, 7 days a week, and we can actually run the report on it to see how many people are also using this out of hours. We have seen massive improvement with DNA rates on some of these. We have worked closely with lots of practices. Most recently, we've been working very closely with the Cambridge practice to do lots of amazing work in the background of their system. But we have seen DNA rates fall from 7% at the beginning, where we first started actually making tweaks on the call flow, now right down to 3.5%. So we do have the evidence to back it up. It is a fantastic system, and using it in the right place will get you better results. But as it is now, or very nearly available for TPP, you will have your CSA reaching out to people if you are interested and you'd like to be added to the list so that we can catch you first. By all means, pop your details in the box and I'll add you to my sneaky list.
Can I
Lucy breathing
just,
there?
Oh, yes, sorry. Heavy breathing again in the corner. I'm just really keen to know, because I heard the other day that even on EMIS, we haven't had a huge uptake of check and cancel. Now, that might be because people don't know it's there, which is what makes your role so absolutely crucial. But I'm just interested in a little litmus test in the chat. Pop a 2 in the chat if you're an EMIS user that is not using check and cancel yet. I'll hold my breath.
The suspense.
I know. I am going to have to get some sound effects, aren't I? Okay.
There we go.
Okay. Well, I'm just intrigued to know if there's particular reasons, Marie, Bernie, and anyone else who's brave enough to put a 2 in the chat, if there's a particular reason why you're not using it, or is it just that you didn't know it was there, in which case put your ODS code in the chat and we'll get these guys to reach out to you to show you where the best place to put it is, or explore with you where the best place to put it is in your system, because it really is, as Gemma's alluded to, a fantastically powerful little tool, free of charge within the technology that already exists. Thank you, Marie. Okay, awesome. Sorry, Gemma, again, interrupting. I'm terrible. I'll stop heavy breathing now.
Watching my nice long work list come through now. It's very exciting.
Yeah.
All of these practices to revolutionise.
Come on, guys. Yeah.
Another included feature within the actual Xflow is our patient callback. Now, most systems do have patient callback on. It is turned on for when your calls come through. They hit your call group, and the system will look for a threshold. We can set that threshold, so whether it's when you've got 10 people in the queue or whether it's when you've got a 10-minute wait, the system will then offer that person a callback. They can press 1 on their phone, hang up, and the system will keep them in a virtual queue until they get to the front, where it will then automatically phone that patient back. Now, that's a service we've had on this system for quite a while, but one of the newest enhancements to that is our new SMS. Now, this is an included SMS. It does not cost you anything more. It gets sent out automatically when people have or choose the option for that patient callback, and it'll open up like that picture on the phone on the screen. It is a live it's a live queue position, so it updates every 30 seconds and will continue showing them as they move down the queue, so they will be sat there ready and waiting to take that call. There is also a button on there that they can cancel that callback at any time, and these can be customized. So we can fill these with any information you would like to as well. So we can use these to support any campaigns you're running. We can highlight features that you have on your website, or just keep people up to date with news and events. These can be changed as frequently as you want, and really simple to change in the back end of your system, and we're more than happy to show you how to do them. But we've seen some practice getting very creative with the messages they're sending out. We have a few that will fill this with things like food bank information over Christmas time and start highlighting their flu and COVID services as we're getting closer to flu and COVID jab time. So it's a really handy feature that is built into the background. I'm going to stop because I can hear Ellen jumping in.
Sorry. I was going to say also, if you are a Surgery Assist user as well, this is where this SMS has been particularly powerful for those using Surgery Assist as well. Ultimately, your patient's opting for that callback. This free SMS lands for the patient, and we're able to actually say, look, while you're waiting, why don't you interact with your digital assistant? And that digital assistant then may actually be able to answer the query that patient may have, enabling them to then cancel that callback as well. So like Gemma said, very much customizable, but if you're using additional features with us as well, like Surgery Assist, we're able to utilize that SMS to, again, educate the patient as well.
And one of the best things about all of that being in the same system is you can track the data, isn't it? So you can report back on that, and that is valuable to you as well. Great, thank you, Gemma.
All the data on this is tracked, even if you've got those links in. So like Ellen says, if you have your link to your digital assistant in it, or you are linking your web page, or you're putting a direct link in there for an information page, you can actually track how many people are clicking on that link to see whether it's actually worth having there. And if it's not, we can reword, we can look at different information to put things in there as well. So we are here to help you grow and to keep looking at that data, and we can keep tweaking, keep amending until we've got that set up perfectly for you. Another one of the included features that we have within the call flow is your personalized call routing. This will support your patient access. This is a little box that we pop into your call flow, and this is fully customizable depending on what cohorts of patients you'd like to add to, and you can add any number to this service. You can have up to 1,500 phone numbers actually added to the service, and you can choose what you want them or where you want them to go. There's lots of different groups of patients that you can add to this. So it's not just for priority patients and patients that you want to skip the queue, even though that is available. You can also use it to highlight certain calls coming through as well. We have practices using it for their patients with, completely forgotten the word that I was looking for then.
Dementia.
That's the one. Thank you. We have it for sites that people use it for dementia patients, so that we can actually bypass any menu options, get them straight through to the call group, and we can prioritize those calls if we need to. We have practices that use it to pull out carers, and we can see actually how many of the percentage of calls coming through are through for carers, and we can choose whether we want them prioritized or whether we just want them through a different route. We also use it for patients that are on their final warning. So it's just an extra opportunity to add in things like stronger zero tolerance messages, or if we've got local services that you want, we can also use this very similar to a bypass line. We can just add their phone numbers in and we can choose where we'd like them on your call flow. And this is an inclusive feature, so it's definitely worth having if you have a cohort of patients that you think fits one of those criteria.
I was just going to touch on the dementia example there. Really lovely flow that a particular practice had built was actually in the background waiting message while they may be waiting in the call queue. There is a really soft reminder. This is a reminder that you've called your general practice. So again, you can really tweak those flows to really work well for this personalised call routing as well. And there's been some really lovely feedback from that particular update that we made.
And all of that is trackable. So you can see how many calls are actually hitting through that block and how many people are utilising it on a day-to-day basis. So it's a really good one to use. We also have a feature called auto step in. So if you do have very peak times where you have lots of people calling through, we can actually set it so certain people are tagged in and out of those groups to support with calls automatically in the background. So we can set it to a queue length or a queue wait time, and the system will automatically then jump that person into the queue or into the group to support with those calls. It will also work the other way. So as soon as that queue length time or that queue wait time falls below the criteria, it will then also step them out. Obviously, this only works if they are logged into their phone, but it is a nice handy feature in the back end. We also have calendar management. Now, calendars are very quiet. They sit in the background of this service and they're not massively utilised other than just for turning your phone system on and off. But on the left-hand side of this calendar, you can see that you can add modes. Now, there's no limit to the modes that you can actually add, and they're all customisable. And each one of these modes we can give specific wording to on your call flow. So you can have these preset to anything that you'd like. So sites will have one as a clinical system outage that will have a dedicated wording on there that when you press that button, that will then turn that wording on. And we can do this for any eventuality within your practice. So if you do have certain points of the day or certain points of the week or the month or the year that you do think actually it'd be really handy just to press a button to put a different message on our phone system, then we can set those up on your calendar for you. So they are there at the click of a button. And that button click has got even easier with the new features that they've added into our phone bar. So the phone bar does pull everything together. It is growing. It is a fantastic tool now. And they do like to sneak some new upgrades in there quite often. So we did want to quickly touch on a few of the ones that they have recently snuck in just to make sure that everyone is fully utilising those services available. And one of them is calendar modes. So you no longer have to open up all of your consoles in the background to drag and drop your calendar modes on so that we can change all of the wording. You can now click a button on your phone bar to put on any message on your phone system. There is also our new amazing silent monitoring feature, which we've had some phenomenal feedback from, and not everyone knows that it's there. So it's definitely one to have a play with. As a supervisor, you can actively listen into any call that is being currently made on your service. And you can click a button to speak to either your user or to take over the call to speak to a patient. This is really handy if you are coaching people through difficult conversations or if you need to take over a complaint on your phone. This also works peer-on-peer now. You no longer just have to be a supervisor. Standard users can invite people to their calls. So if you have standard users training standard users in your reception area, they can invite each other to those calls. They can listen in. And again, they have that functionality that they can click to talk to the user to coach them and train them through that call, or they can click the button to also speak to the patient or whoever you have on the phone. It is a fantastic service, so it's definitely one that you should go in and press all the buttons and have a play with. But if you are interested in going through any of the features of the phone bar, or you're not using the phone bar and you would like some training, we're more than happy to organise that one for you as well.
Did you get a bit trigger happy there, Ellen?
I apologise. Yes, my
getting
getting did
excited now.
slip down. So sorry. So sorry.
Just, I'm going to take the opportunity actually just to say once again, pop your ODS code in the chat if, as Jem has alluded to, you want to talk to your customer success advisor and get one of those review meetings booked in. Make sure that you're using every little tool and feature that's available to you that's going to make your lives a little bit easier. ODS in the chat, that's all you've got to do, and your customer success advisor will reach out. Go on, Ellen, round us off.
Well, I was just going to round it off that it's been very Xflow heavy. I think we just really wanted to start off with the basics there of actually what is available within your Xflow and all of the free features that are sat there ready for you guys to all access. But I just wanted to say a part of those account reviews, no matter what product you're using, we will touch on them all. So yes, we will start off with the basics of the Xflow, but then of course, if you are a Surgery Assist customer as well, we will make sure that those flows are appropriately working and supporting the Xflows. And it all goes back to equitable access, making sure your patients have the choice of how they wish to access your services. Would look at Omni and of course AVT and make sure that's being utilised in the right way. And that's where the training team can really help support in perhaps where there might be gaps in knowledge and understanding of exactly how the products all work so beautifully together. That is supercharged by Surgery Insights, which is a data dashboard, all encompassing NHS app information, online consultation information. It's all there in one place. And that's where we can start really telling the story to you as our customer. Look at the difference you're starting to make now by using the tools in the right way. And that is us.
Well, I think it's a really nice place to finish, actually, because I think it's worth noting all of these products are available individually, actually. So you can get Connect without Assist, you can have Assist without Connect, and vice versa. But when you put them all together and you start to look at all the tools and the features and you get you guys involved helping you optimize all that, well, Claire's put some comments in the chat, Claire Jackson from the Cambridge practice, who particularly calls out Gemma and the work that she's done and the impact it's had there. It really is a phenomenal story from where they started to where they are now. I'll share that in the follow-up email, but I think it's worth a read. To her point, though, I'm going to ask a probing question because nobody else has put any in the chat, so it's me. I'm just interested, how do you support the practice in working with patients? Because part of the problem, I think, is that practices have, and correct me if I'm wrong, is that you've got to get the patients on board with some of the digital tools. Yeah,
and I very nicely goes in actually to our CQC. It's mandatory, of course, that we have a PPG, but actually getting the PPG's voice and hearing that there's been sort of some collaboration on decision making. It's a big tick box when it comes to CQC as well. We know PPGs sometimes can be challenging. We had a brilliant session with the Cambridge practice where the PPG came along, but I tend to find that they're a brilliant test bed. Test them, see what they think, get their feedback. We know there's going to be some negative and some positive, but I think it's really important you take the patients on the journey with you, and so that they actually have an understanding why a practice is making a decision. I think it's easy for patients to jump to conclusions that all this digital tech is being forced on them. Again, it goes back to the lovely point about equitable access and actually what does that mean, and making sure that the patients actually understand that's exactly what you're building, the opportunity for the patient to make their choice on how they wish to access services.
So there you have it, folks. We support with that as well. Can you imagine? One final question I think that's worth asking. Gemma, this one's for you, really. If you were to walk into a practice tomorrow, what do you think the first thing you would change or look at would be, whether it's the metrics or a particular feature?
I think the first thing I'd look for, not really, because there's lots of things that you'd actually look for, but I think the first thing would be to see how the actual reception team and how the team within the practice are doing. You can tell quite quickly if you walk into a practice and the team are already looking stressed that actually that's when we need to do some deeper looking. There's some words there. They will actually come out. It's
very hot, Gemma.
It is very hot. We're blaming the heat for everything. But it's a really good place to start is actually looking at people's stress levels, because then we can really start pulling apart all the different features that they're actually using, all of the different services that they're using as well, and building that up from the bottom is always the best place to start, because there's so much we can do on this service, but sometimes it does take pulling it apart and putting it back together to give you the most drastic change, but also the most relief within the practice. So that's where I'd start. If everyone was looking nice and calm, then you start looking at some of the top level features. We like a bit of carnage. We like to be able to prove how amazing this system is. So if you're one of those practices, please let me know. I do like to get my teeth into a bit of carnage. It's good fun.
I tell you what, the quote of the day is, "I like a bit of carnage." All right, well, we'll remember that, Gemma. Thank you. We have had a sneaky question from Debbie around text message costs, which I think, go on, Elle, you can probably take this one.
I don't know what the question exactly is on the SMS costs, but
Can I ask a question on SMS costs? Well, we can interpret that as we're waiting for the question, but I think what she's referring to is, earlier we said we can text from the system. Was it around check and cancel? So
yeah, I think so. Yes, with the patient callback feature, that is a free SMS. So it is really important, if you are using that, make sure the wording is right and make sure you're hammering home that message to your patients. There are other SMSs within the call flow that might be directing out to Pharmacy First, to your digital assistant, or even directly into your online consultation tool. There is a charge associated with that, but I caveat that with, what does that return on investment actually look like? If you're able to better signpost at that very point of need for your patient, that ROI can look really quite transformative for you as a practice. Less demand coming in, the ability then to ultimately be able to focus on that proactive level of care as well, because of that demand coming into your reception teams is decreasing. It's not about getting rid of anyone in reception. It's about actually moving them into a role that's more of a proactive push on the likes of quaff and recall. And bit of a long-winded answer there, but hopefully but that's about right.
It's a valuable one, and there's some more detail, I think, around specific SMS costs in the help centre, which I'll send out in the follow-up email. Debbie, I know you've already submitted your ODS code, so I'm sure that can be dived into a little deeper in your one-to-one with your customer success advisor. But if there are any more questions like that, please pop them in the chat right now, and we will respond to them following the webinar, because we are actually wrapping up. So I do just want to call out one thing that kind of ties in quite nicely, I think, to today's content, and that is the summer webinar series, where the trainers are actually going to be picking up the mantle around optimizing your practice using surgery insights. So probably elaborating a little bit on some of the stuff we've talked about today, but it might be worth you or a colleague popping along to one of these free training sessions throughout the month of July. So I'll pop the link in the chat. You can find a date that suits you and register. That is it from us today. Thank goodness, because I need to put my fan back on. We hope you've enjoyed it. A really big thank you to Gemma and Ellen. That was really fantastic. I learned a lot. I hope you guys did as well. Thank you to all of you for your participation, particularly in this heat. It's been amazing. So thank you very much. The next webinar will be in July, hopefully a follow-on from this one. So do keep your eyes out for a link. In regards to today's content, we'll make a recording available to all registered attendees in the next couple of days with all the relevant links and anything else that you guys want. We hope to see you all back here for more interaction next month. But in the meantime, on behalf of us all here at X1 Health, have a very happy and healthy June. We'll see you in July for more, shall we? Thank you very much, everyone.